So in trying to refresh our memories on what infections and how infections could be able to resist treatment. Of course, this is in orthopedics, but we spoke about various inflammations in the body, and the Staphylococcus aureus was implicated and all of that. So the next is what's known as a methicillin-resistant Staphylococcus aureus. So what is a methicillin-resistant Staphylococcus aureus? Of course, this type of organism, all right, it has one or two things that is making it not to be respondent to a drug. So it's just a type of bacteria. It has become resistant to many antibiotics that you use to treat bacteria, and the bacteria die off. For this type of bacteria, over time it has developed mechanisms to resist. So it makes it a serious public health concern. It's often referred to as a superbug. All right. Now, superbug, because if it occurs to you as you are treating, it's resisting. You understand? So what is it? It's a strain of Staphylococcus aureus. It's resistant to methicillin and other beta-lactam antibiotics like penicillins and cephalosporins. So it can cause infections from mild skin diseases to pneumonia to bloodstream infections to sepsis. Okay, so you see some of the infections caused by it. Okay, so these are the types gotten from the healthcare. A type is gotten from community. A type can also be gotten from livestock. Okay, that's people that are in veterinary settings and all of that. So if you are infected by a methicillin-resistant Staphylococcus aureus, what could be the possible symptoms? So skin infections. You have redness, swelling, painful bumps. Then if it is systemic one, you have fever, chills, fatigue. Then it also leads to complications like accumulation of pus, that's abscess, difficulties in breathing, that's pneumonia, all right, inflammation of the heart, okay, then osteomyelitis, that's inflammation of the bones. So how it can spread is direct contact, colonization, then if you stay in a place that there is a high risk for it. Okay, so diagnosis is just blood tests, wound tissues, okay, so nasal swabs. We are taking all of this to the laboratory just to pinpoint that this bacteria is implicated. Then if it is abscesses, that's treatment. If it's abscesses, you drain it. You also employ antibiotics like vancomycin, linezolid, daptomycin. Then surgical removal of any tissue that is infected around that place. Right. So that's it for methicillin-resistant Staphylococcus aureus.